Namaste. I'm here to share today the experience of Gujarat in midwifery led care. The overview of the presentation that I propose to make is about, first of all, the history of this midwifery program in Gujarat. What is our vision of the midwifery program in terms of establishing the MLCUs, midwife led care units, capability building of all the stakeholders concerned, how to integrate it with the mainstream health systems, alternative birthing positions, and all these other options that go with midwifery care led units, and also, most important, giving back dignity and respect to the mothers, and hence respectful motherhood. How do we bring in this whole experience of dignity and respect to the mothers? And in terms of integrating this entire perinatal period, including the antenatal and postnatal period, we have coined this 1,000-day approach and have also had the first hospital, perhaps in the country, in Rajkot, which became a 1,000-day compliant hospital way back August of last year, and also looking at the research and innovations that we're trying to do in this space. So the history of midwifery programs in Gujarat goes back to the year 2008, when there was a visit and a learning interaction with Sweden, after which this process of training of the nurse practitioner midwives started, and recruitment of these NPMs also started on a small scale in 2014. And then 2018 onwards, we have really been trying to push this in a more sustained, in a more definitive way. Establishment of midwife-led care units at our medical college hospitals. And then, of course, now even at the urban CHCs, because the idea was, how do we get the inverted triangle back to the normal triangle? And we wanted to demonstrate this in the case of midwifery and see how needless escalation and medicalization of the process, which is a very normal process of delivery, how that can be achieved. And basically also to give a lot of confidence, a lot of dignity, support to the mothers, and to make her believe, and her caregivers, the entire ecosystem, believe that this is a very natural, a very happy sort of process for the mother, and doesn't have to go with these wrong perceptions of pain and over medicalization. Unfortunately, that over the years we've got it to take a shape, and how people have started believing in that lines. So in the year 2020, this year, notwithstanding COVID, we've really pushed this in a big way, tried to scale up training, recruitment, and tried to operationalize as many of the MLCUs, and also put together the guidelines for this, because all these processes, the nuts and bolts of how to roll this out, is now a little more structured, and we've tried to do that. So the patient load distribution also, as a result of this, we do wish and hope, while we are initially co-locating the midwifery-led care units along with the obstetricians and gynecologists in our medical college hospitals. Once there is enough confidence, we have slowly now moved to have a midwife-led antenatal care unit, and then slowly wean these completely to the CHCs and so on. So the proposed solution is to have dedicated MLCUs at the medical colleges, and also simultaneously, parallelly, strengthening the urban district hospitals, SDHs, CHCs, labor rooms with midwife, and ensuring that this all-round 1,000-day compliant attitude, approach is reflected in all the stakeholders in this, the entire chain of people and stakeholders involved, so that everyone is on the same page and starts believing in this philosophy and practicing it. So we've not only started by establishing MLCUs, but the idea is also to include, as we said, dignity and respectful maternal care, and this possibility of alternate birthing positions, giving mother, fortifying her with choices, but also having this first 1,000-day approach, realizing that as many as 100 billion neural networks get formed in these 1,000 days when the baby, from the time of conception to the time the baby is about 2 years old, and also have a lot of research, innovations and experimentation around this to make this process a more process fortified with choices for the mother, for her to choose how she wants it, and also get our entire ecosystem to start respecting these values, these choices of the mother. Capability building, capacity building of different stakeholders involved, the antenatal care, the perinatal period, all the players involved in it in the case of a normal delivery, mainstream, but also in cases where there are complications, and of course the pediatricians and the care that follows post-delivery as well. And along with this, the health system strengthening, meaning ensuring that the equipment, and a lot of it is not necessarily to do with costs, but ensuring that the equipment, the infrastructure, consumables, and the culture over there in these hospitals, in these spaces, are conducive to this whole process of demedicalization and making it more and more friendly for the mother, and making this whole process a happy, pleasant, and a very natural process for her, filled with dignity and respect. So establishing these midwife-led intrapartum care units, we've done this in a big way in many hospitals, and we have several of our champions. To name a few, we have Sister Bhanumati in Baroda, who's one of them. You're seeing some pictures in this presentation of how the Baroda system, the rooms there have really come to signify, and they've come to really represent the philosophy of MLCUs, with a lot of empowerment of the NPMs, the nurse practitioner midwives, and through them the mothers, and how they're really actively engaging with the mothers to give them a lot of choices, how they work with gym balls, exercises, how there's a lot of soothing music, and how they're co-located next to the labor room just in case there is any contingency or any situation. Then there is also very seamless transition, and also instrumental music facility for simple things like a shower, and giving the mother an option to walk around, move, and also choose to have different birthing positions, not just the lithotomy, but if she wants to do squatting and so on, all those are available. Again, the flows in the department of obstetrics, which have MLCU, we've tried to make it easy so that those mothers, when they come in with labor, based on the assessment, a simple triage, those with complications are immediately taken care of by the obstetrician. They led to a labor room which is sort of led or headed by it. Whereas those women who do not have complications, they're taken to the MLCU, and with respectful maternity care. And we're also trying to promote physiological labor, birth, and if there are no complications, then again ongoing care by the NPM. If there is any complication, we again have this possibility of immediately at any stage moving the mother to the obstetrician-led labor room. So the performance has been quite encouraging in spite of COVID. If you look at the window last 1 year, we found that in a lot of our medical colleges, nearly 28% of the deliveries that happen, particularly the large facilities, are now being done by the NPMs. But however, our experience in the community health centers, the urban community health centers, is even more encouraging. We are seeing, for example, CHC Mora, CHC Sarkhej, Jammu Sir, all of these, it's as high as 84%, 83%, 70%, which are the NPM deliveries, and the others are those that are done by the medical officers and other staff deliveries as against this. So the care in MLCUs, we have a very humane approach. So it's all about the training, that sensitivity, and then giving them different positions, exercise, massage, all of these. So this is the antenatal OPD also that has now started in Baroda. And we find that that is also a big hit. And development of the state-of-art infrastructure there as well, with a lot more awareness. But the main thing is to give them all these choices and make them aware of these options. Capacity building has also been done in a very big way. Totally about 492 midwives have been trained, and 6 government nursing colleges are training midwives with an annual intake of nearly 132. So that has also got institutionalized, and we now plan to increase these courses and NPM colleges in all our nursing colleges with an annual intake of 60. So the total strength could go up to about 600 per year. And we're also trying to include private nursing colleges, and in every nursing college we want to have a dedicated MLCU to have hands-on training. Health systems strengthening as well. We have done this with detailed operational guidelines issued by our Commissioner of Health. So the entire team is committed to this, and we're really trying to establish nursing and midwifery cell as well. The alternate birth position workshops for midwives in Gujarat was also a very big hit. We had midwife trainers from Fernandez Foundation too, and we had participants from 6 medical colleges, and I had the pleasure of participating in some of these, attending some of these briefly, and seeing the kind of enthusiasm, the kind of energy that some of these training workshops have evoked, and it has resulted in people practicing this and actually very passionately adopting this. We've also had a one-stop all ANC services 1000-day compliant facility as well, which includes dental checkups, physiotherapy, exercises, ANC, and of course, very important is this whole system of physiological cord clamping. So I have personally had the privilege of witnessing this silent revolution in some of our labor rooms where there's no sound, where the mother is really very warmly encouraged and there is very soothing music. It's as if the people handling the mother are speaking in whispers, and actually you see the baby getting delivered and very, very normally, naturally, within a matter of a few minutes, perhaps 5 to 6 minutes, you have the placenta also getting delivered naturally, and we refer to this as the lotus birthing because you see the baby, as I refer to, I've written about this as well, the Indian lord called Padmanabha. You have the umbilical cord with the placenta also there kept in the kidney tray. So this sees, and immediately as soon as the baby is born, baby is placed on the mother's chest for doing what is known as a chest crawl. So we're really encouraging this kind of warm kangaroo mother care, immediate and exclusive breastfeeding also is being encouraged, so that you really allow the natural processes to take shape and to take charge and allow and respect the choices of the mother. We've also had studies which are going on in respect of physiological cord clamping at different centers, including the Srimad Rajchandra Hospital at Dharampur, and we found that this is really extremely beneficial for the newborn mother, baby and the mother. Increased blood volume, oxygen, iron. And we're also in the process of having a multi-centric study planned across Gujarat. So we're extremely happy and proud of our champions who are really taking this forward, all the way from some of our obstetricians to the main heroines of this, the heroes of this are midwives, nurse practitioner midwives, and they're all exuding a lot of energy, very, very happy, positive about this. So as we go ahead, we want to make sure that we look at this issue in totality and see how we can provide this choice in almost every labor room, and also open up continuous professional development, career progression pathways for the midwives, and also ensure that the birth attendant is also made a part of this, so that there is more affirmative action, even things like birth hypnosis, etc. So that this whole process of giving birth, which is one of the most beautiful processes or one of the most beautiful phenomenon, events that nature has gifted us, if we can really allow and the mothers and the caregivers and the babies to enjoy this, relish this in the most beautiful manner. So once again, Gujarat is very proud of all the partners collectively who've made this happen. We're very happy that we have had the opportunity of working with all these mothers, with all these beautiful midwives, babies, and we do hope the silent revolution really becomes a bit of a silent storm and embraces in this movement, this philosophy of dignity, of being very humane, all the mothers, all the pregnant women, and removes all those fears, all those apprehensions, and sometimes even the kind of frustrations and disgusts that some women, unfortunately, because of the stories, the experiences that they may have heard about this whole beautiful process, if we can gradually wipe out all that and make this a very normal, very natural process, we would be very privileged to do that. Thank you. Namaste.